NvCAN exists to give families access to care that they wouldn't otherwise be able to have. I'm Dr. Jan Marson, co-founder of NvCAN. We saw a need in northern Nevada, especially to support kids and their families through assessment and other types of community and therapeutic supports.
My name's Dr. Deborah V. Hill, and I am co-founder of NvCAN. So you get a child that gets diagnosed with autism, or the child might have something else occurring. There could be ADHD, there could be schizophrenia. There could be a number of different things that are going on with these kids. They would not get the kind of assessment that is necessary that can then lead to the correct treatment. And that's what it's all about, is making sure that they can get the treatment that they really, really need.
Yep, so I'm Randall Owen. I'm the director for Nevada Center for Excellence in Disabilities. Diagnoses are very important because you can't get services without the appropriate diagnosis. So I just think the reach into the rural areas is really important. Not everybody can get to Reno to get to these services. I think one of the innovations that NvCAN has kind of made over the last couple of years is doing more of these mobile clinics where they'll go out in the rural areas and see some families and kind of do the first layer of diagnostic, right? And having that kind of first step, I think, is a really good way for us to reach more people.
My name is Dr. Girija Kadlaskar, and I am a research assistant professor at the University of Nevada, Reno, and I work at the University Center for Autism and Neurodevelopment. My main focus of research here is basically looking at all the clinical data that NvCAN has collected over the past 20 years, and they have data that looks at demographic factors, cultural factors, sensory behaviors, cognitive, language, developmental outcomes, and diagnostic outcomes. There is lots of research suggesting that autism can be diagnosed as early as 3 years of age. However, we know that in the real world, not everybody gets the diagnosis as early as 3 years. Many children get it when they are teenagers, and there are also individuals who get the diagnosis well in their 30s or 40s.
It was important for us and for us to be able to recognize these kids, but also to deal with these families. The difficulty that we really had at the time of starting to look at these kids was that there weren't enough people who were trained. Having different professionals from different backgrounds was really helpful in getting a whole picture of the child.
I'm Dr. Stephanie King. I am the NvCAN director. So the prevalence of autism currently reported by the CDC is 1 in 36 children aged 8 years. The importance of early intervention includes getting access to therapies as early as possible to help those developmental outcomes. It's also crucial that the parents understand what their child is going through and how they can support their child through that process.
When you know the diagnosis, you can develop a pathway, and there's real peace. And sometimes you might not get the autism diagnosis, but you're going to get information about your child and what they need. So we've been really successful because here in Nevada, there's this can-do spirit of getting things done. You might have to drive, you might have to go that extra mile, but parents, they're going to do it for their kids.